My name is Dr. Ronald Hirschberg. I'm a veterinarian who's been in practice for 41 years, and I have been using light therapy for the past 13 years. People ask me how I have seen light therapy impact my practice, both from a standpoint of income as well as a standpoint of quality of medicine. I think that light therapy is probably the most important modality that we've added to our practice over the past many years. It's not only good medicine, but it is also good business. It gives us an opportunity to treat a variety of diseases, but continue much more contact with our clients than we normally would if we were treating diseases for which we would just dispense medication. The number of conditions that one can treat with light therapy is virtually endless. That being the case, it also creates a flow of clients through the door that even in quieter times will maintain a certain activity. Probably the thing that comes to mind the most is the treatment of chronic joint disease, osteoarthritis, those type of condition, where in many instances one would merely make the diagnosis, provide medication, and oftentimes the client will ask for the medication being dispensed via one of the online pharmacies. And then you may not see that client again for a month, 2 months, 3 months, whenever you request that client to return for blood work or laboratory work in order to assess whether the medication is still being safe for their pet. And if your practice is like ours is, that was always a discontented client who didn't understand why blood work needed to be done. With light therapy, on the other hand, you're constantly having that contact with your client. Once every week, once every 2 weeks, once every 3 weeks, depending upon the interval. You have a face-to-face with the client. You can discuss the condition. In our practice, we find that since we've adapted widespread use of light therapy, we have seen the income from that modality comprise nearly 8% of our entire practice income. That's just when we push the button. In other words, any diagnostic workup, any discussion, any ancillary work that we may do before we wind up placing a patient into the light therapy realm, that's not even included in that number. I would say that use of light therapy and photobiomodulation impacts somewhere in the vicinity of between 10 and 20% of our practice income. Our clients accept it very, very well because it's a modality that they see us use. We place our hands on the pet. They're present when we use it. It's a modality that is extremely effective, in which case they will often see improvement within as little as 1 or 2 treatments. This is better medicine, it's better business, and it certainly is better for the client and building client numbers.